Have you ever worried about a strange rash on your child's skin? Or watched their temperature spike, wondering if it could be something more serious? In our story today, we're diving into the common concerns parents face. Join us as we explore how a mother's love and a doctor's expertise came together to solve the mystery. Stay with us to discover the answers and reassure your parental instincts. Once upon a time in a quiet neighborhood, there lived a loving mother named Zara and her cheerful 5-year-old son, John. Their days were usually filled with laughter and play, but today was different. John had developed an itchy rash around his mouth, and his temperature had spiked. Concerned and worried, Zara decided to take him to see a child specialist, hoping to find answers and help her little one feel better. Dr. Smith, a trusted child specialist in their community, warmly welcomed Zara and John into his clinic. As he examined John's condition, Zara's face showed a mix of worry and anticipation. She couldn't help but think of the possibility of herpes, a word that had been causing her many sleepless nights. Dr. Smith, sensing Zara's anxiety, kindly reassured her. He began to explain the situation in simple, reassuring terms. "I understand your concerns, and I'm here to help John feel better. I suspect what John has is not herpes. We often see these symptoms, especially rashes around the mouth and high-grade fevers, in children. It's more likely to be impetigo or school sores, a common and treatable skin condition." Zara, relieved to hear the comforting words, asked, "Impetigo? What is that, doctor?" I explained, "Impetigo is an itchy, sometimes painful, skin infection. When your child gets a cut, bite or scratch that opens their skin, bacteria can enter and cause a bacterial infection. But impetigo can infect skin even if it's not broken or punctured. Impetigo happens more often in warmer months when children are outside. Typically, the first signs of impetigo are sores and blisters on your child's mouth and nose. It can also appear on your child's scalp, hairline, legs and arms. There are a few different types of impetigo, including non-bullous, bullous, and ecthyma. Non-bullous is early-stage impetigo. It's the most common type. The non-bullous impetigo early stages include developing one or more itchy sores that quickly burst, red or raw skin where sores have broken open, swollen glands near the sores, forming honey-colored crusts over the sores, but the skin eventually heals without scarring. Bullous impetigo is a rarer type of skin infection. It's more common in infants. More than 90% of cases of bullous impetigo affect children younger than age 2. The stages of this type include, large, fluid-filled blisters form on your child's skin, redness appears around the surrounding skin. The blisters become clear and limp and then break open. Crusty sores form on your child's skin, and their skin heals without scarring. Untreated impetigo can develop into ecthyma. Ecthyma is a more serious type of skin infection. It goes deeper into your child's skin. The stages typically include, painful blisters form on your child's skin that turn into deep, open sores. Thick crusts develop on your child's skin, and redness often appears near the surrounding skin. After your child's skin heals, scars may form because the infection went deeper into their skin. Doctor, how common is impetigo? Impetigo or school sores is the most common skin infection in kids between the ages of 2 and 5. Can adults get impetigo? Yes, impetigo can affect adults. In adults, the condition may occur after another skin issue. Sometimes it develops after you've had a cold or another virus. You may be at higher risk if you live in a tropical climate with hot, humid summers and mild winters. Participate in skin-to-skin contact sports where cuts and scrapes are common. Live and close contact with others. Infections often occur among people living in the same house. Impetigo or school sores versus cold sore. Impetigo and cold sores are both common skin infections that can cause blisters. Cold sores usually occur around your mouth and consist of small blisters. Impetigo can form around your mouth but also on other parts of your face and body. It causes larger blisters. A bacteria causes impetigo, whereas cold sores are a symptom of the herpes simplex virus, HSV. Doctor, when do impetigo symptoms start? Typically, symptoms of impetigo develop within 3 days once the bacteria infect your child's skin. Impetigo on the face starts around the mouth and nose. However, impetigo on the scalp or hairline can also occur. What does impetigo look like? Impetigo includes blisters, rashes, and other skin wounds, lesions. The condition includes the following characteristics. Impetigo blisters may be pus-filled and burst easily. The fluid may be yellow or tan and it may seep out and form a crust. Impetigo rash can spread and cause red, raw skin. Skin lesions on your child's lips, nose, ears, arms and legs may appear. The lesions can spread to other parts of their body. Swollen lymph nodes near the infected area may develop. What causes impetigo? Impetigo causes include certain types of bacteria that lead to infection. The most common impetigo bacteria include Staphylococcus aureus causes 80% of non-bullous impetigo cases. The bacteria usually enter your child's skin through a cut, scrape, rash or insect bite. After they enter your child's body, the bacteria continue growing in their skin. This can lead to inflammation and infection in the top layers of your child's skin. Your child may also get impetigo by scratching something itchy on their skin, such as chickenpox or eczema. When they scratch, it breaks the skin, making it easy for bacteria to get in. Impetigo may also occur without any skin breakage. Instead, it can occur after you've experienced another skin condition, such as head lice, scabies, eczema. Adults can also get impetigo through health conditions such as tattoo infections. Can stress cause impetigo in adults? No, stress doesn't cause impetigo. However, stress can weaken your immune system. With a weakened immune system, it's easier for bacteria to infect you and harder for your body to fight them. Doctor, is impetigo contagious? Impetigo is highly contagious. Most people get it through direct skin-to-skin contact. You can get impetigo by coming into contact with sores, mucus or nasal discharge from someone who has it. Children and athletes, such as football players and wrestlers, often get it this way. People can also spread impetigo by sharing items such as towels, clothing or other personal items with an infected person. How long is impetigo contagious? Without treatment, impetigo can be contagious for weeks. After starting impetigo treatment, the condition is contagious until the rash disappears, scabs fall off, you've finished at least 2 days of antibiotics. Doctor, what are the complications of impetigo? Complications are rare. Certain strains of strep bacteria that cause impetigo can also cause glomerulonephritis. This inflammatory kidney disease can produce high blood pressure and blood in your pee, hematuria. Other complications of impetigo may include the rash spreading to deeper skin layers, the bacterial infection spreading to other parts of your body. How is impetigo diagnosed? A healthcare provider will diagnose impetigo based on how your child's sores look. They may take a skin culture to send to a laboratory. How do you treat impetigo? Impetigo treatment includes antibiotics. Your doctor may prescribe topical antibiotics to put directly on your child's skin. Impetigo treatments may also include an oral antibiotic if the impetigo covers a large area of your child's skin or multiple body parts. Doctor, how to get rid of impetigo in 24 hours? Impetigo won't go away for everyone in 24 hours. However, some studies have shown that the condition goes away quicker when you use an antibiotic cream. Providers recommend these creams to help the symptoms go away fast and to help stop the infection from spreading. Therefore, the sooner you receive treatment, the better. For minor skin infections that haven't spread, you can try treating the area with an antibiotic cream. Then, place a non-stick bandage over the area to help prevent the infection from spreading. Taking care of your child's skin can help clear up an impetigo infection faster. Skincare steps you can take to get rid of an impetigo infection quickly include: dab the infected skin with warm soapy water to gently remove crusts. Apply the prescribed antibiotic the way your provider suggested. place a bandage over the infected area. This will help promote healing and prevent the infection from spreading. Will impetigo go away on its own? Impetigo may go away on its own in a few weeks. Still, healthcare providers recommend treating it for several reasons. You reduce your risk of developing complications. You reduce your risk of spreading the infection to others. Without treatment, the infection can go deeper into your skin and possibly cause new sores or blisters to develop. Doctor, can I prevent impetigo? The best ways to prevent infections include: keep your hands clean, wash your hands regularly. Use an alcohol-based sanitizer if you don't have soap and water. Practice good hygiene, clip your and your child's fingernails regularly to avoid scratching. Sneeze into a tissue and or your elbow and then throw the tissue away. Don't scratch cuts or wounds. If your child gets a cut, scratch, or wound, keep them from scratching it. Clean cuts, scrapes and injuries with soap and water. Then put an antibiotic cream or ointment on the wound. Wash underwear, towels and sheets in hot water. Doctor, what's the outlook for someone who gets impetigo? Antibiotics can treat impetigo, but the condition can return, especially in young children. Children are especially prone to scratching and opening their scabs, putting them at a higher risk of reinfection. However, most kids recover with no complications after they receive treatment. How long does impetigo last? With treatment, your child usually isn't contagious after 48 hours. The sores may take some time to heal completely, but the infection rarely leaves scars. Without treatment, impetigo may clear up on its own in a few weeks. But there's a greater risk of developing complications, and you may see new sores and blisters. Doctor, how long does impetigo live on surfaces? The bacteria that cause impetigo can live on dry surfaces for weeks or even months. Zara asked, when can go back to work/school? Impetigo is very contagious. Your child should stay home from school for 48 hours after starting an antibiotic. Adults don't need to stay home from work, but they should avoid contact with other people and keep their sores and blisters covered. Zara felt a weight lift from her shoulders, hearing that her son's condition was manageable. Doctor prescribed antibiotics and gave her some guidance on how to care for John at home. Remember, Zara, practice good hygiene, keep the affected area clean, and try to prevent John from scratching the rash to avoid spreading the infection. With newfound confidence, Zara thanked Doctor for his expertise and support. She left the clinic with a sense of relief, knowing that John was on the path to recovery. As the days passed, with diligent care and the prescribed treatment, John's impetigo started to improve. Zara watched her son's playful spirit return, grateful for the reassurance and care she had received from Doctor. In the world of parenting, there are moments of worry and doubt, but there are also moments of reassurance and resilience. Zara's experience reminds us that, as parents, our concerns are valid, and it's crucial to seek professional guidance when our children's health is at stake. So, if you ever find yourself in a similar situation, remember, there's a vast network of support and knowledge available to help you navigate these challenges. Trust your instincts, seek medical advice, and always put your child's well-being first. We hope you found this story both informative and reassuring. If you did, please consider subscribing to our channel for more valuable insights, tips, and engaging stories to support you on your parenting journey. Together, we can create a healthier and happier world for our little ones. Thank you for watching.